Hi, on behalf of the Ministry of Health, we are here to present a public health strategy to aid the development of the country Malawi. Malawi resides in sub-Saharan Africa and is currently in early stages of epidemiological transition. Malawi's economy is heavily dependent on agriculture, however, recent droughts in Malawi have accounted for a decline in the overall income of the country. As a result, Malawi is consistently dependent on external aid from more developed countries in order to sustain development. In terms of politics, Malawi is a democratic country and has a stable government. But due to a lack of funds and very high percentage of population still living in rural areas of the country, the support needed from government is subpar at best, resulting in an economic spiral the country seems to be stuck in. The top three concerns pertaining to the health of the country are HIV/AIDS, acute respiratory infections, followed by malaria. HIV and AIDS are sexually transmitted diseases. Acquired immunodeficiency syndrome (AIDS) is a life-threatening disease caused by human immunodeficiency virus (HIV). HIV affects your body's ability to fight infections and cells that cause diseases. In 2012, it was reported that 27.1% of deaths in Malawi are HIV/AIDS related, along with 1 million citizens who were diagnosed with HIV. The risk factors associated with HIV/AIDS include pregnant mothers who are infected pose a risk of transmitting it to their child. Having multiple sex partners, having unsafe sex, as well as already being infected by another STI also increase the risk of contracting HIV/AIDS. Ignorance is also common among Malawians as they don't receive the proper education. They tend to believe that they will not contract HIV/AIDS. Acute respiratory infections account for approximately 8.6% of total deaths in Malawi. The risk factors associated with these infections include children under the age of 5, as they are more susceptible to pneumonia and is the cause of 13% of deaths among children. Improper ventilation and the use of solid fuels are the main cause of acute respiratory infections, approximately 98%. Some other risk factors include poor hygiene and poor hand washing practices. Malaria is an infectious disease that results from person-to-person transmission by the Anopheles mosquitoes. Malaria was the cause of 9,484 deaths in Malawi, which equates to over 6% of total recorded deaths in the country. 40% of hospitalized cases were infections of malaria. The risk factors of malaria include the following groups: infants, children under the age of 5, pregnant women, patients with HIV/AIDS, non-immune migrants, and travelers. After assessing the current state of Malawi, the recommendations that we have composed to improve the health of Malawi are as follows. Education must be highly stressed upon adolescents, as these are age when individuals become sexually active. The use of condoms should be promoted in order to promote safe sex. It is important to communicate the risk factors and consequences associated with unprotected sex. It is also important that individuals are tested for STIs, in this case HIV/AIDS, to prevent the transmission not only through sexual intercourse but also through pregnancy at the risk of transmitting it to the baby. In the case of acute respiratory infections, it is important to educate mothers as well as the children. Children are at high risk for these infections, therefore it is crucial to prioritize the education of the risk factors and prevention methods to mothers. This can be accomplished by creating a community education organization, which aims to educate mainly women and children. Women would meet in groups, and from those groups, the information will be distributed from one mother to another. In addition to receiving this information, they would be participating in family planning. Mothers would be given this information, which would provide education on safe cooking practices and alternatives from fossil fuels. It is much more practical to groups as the information is provided to more people at once, making the information sessions highly effective. Children must also be educated within schools so they are aware of proper hygiene and sanitation methods, in addition to recognizing symptoms of acute respiratory infections, especially pneumonia. If the children are aware of the symptoms, they would be able to report it in order to treat it at early stages. As for vaccinations, these must be provided by government-run clinics with licensed doctors and nurses, and they must be accessible for people in all geographical areas of Malawi. These vaccinations will lower the number of people suffering from this disease and also provide another means of education where condoms are available along with HIV/AIDS testing within the facility. In order to reduce the burden of malaria, methods of prevention are needed. Treated mosquito nets are used to prevent being bitten by a mosquito by killing them. Spraying residual insecticides indoors would ultimately keep the disease-carrying mosquitoes out of the home and terminate them. These methods of prevention are very effective but must be readily and easily available to people and geographical areas. Vaccinations for malaria are known as Mosquirix. It is an injectable vaccine which will help protection against malaria, especially in young children. This infection Injection would be offered to all children within schools. For adults, it must be easily accessible in local clinics and hospitals to ensure prevention from this disease.